Thank you, commissioners. Franklin County, Joy Bivens, Deputy County Administrator of Health and Human Services. I got it right, boss. The Franklin County Department of Job and Family Services 2021 proposed budget is $93.7 million. This recommended budget includes $44.4 million, which is 47.4% in personnel services and fringe benefits to support our dedicated staff. Our staffing level target for 2020 is 625 full-time equivalents, or FTEs, and the target for 2021 is 635 FTEs. We maintain staffing levels above 615 FTEs for the first 9 months of 2020 and have been above 620 since mid-May, and as of November 9th, we have 623 full-time equivalents. Our recommended budget also allocates $10.2 million, which is 2.8% for materials, supplies, services, and capital building lease, including $2.8 million for temporary staffing consistent with the 2020 budget. The remaining $39.2 million, which is 41.8% of our recommended budget, is reserved for social service contracts and programs to directly assist our most vulnerable residents. I, along with our Chief Operating Officer, Laura Rapaski, and our Chief Financial Officer, Christy Russell, will be happy to answer and address any questions you may have regarding our recommended funding streams or staffing levels. However, I would like to use testimony to highlight some of the challenges and achievements JFS has experienced throughout this unprecedented year. Over the last several years, I've used our testimony to highlight how Job and Family Services has transformed from the transition to Ohio benefits eligibility system in 2018, which required us to completely overhaul the way we do business, to the adoption of the Rise Together Poverty Blueprint in 2019, which called on us to re-examine the why behind our mission and strategies we rely on to advance it.
Joy, you've accidentally muted yourself.
The over 360,000.
You've only been doing this a year.
What you said?
I said, we only been doing this a year. You just keep muting yourself. And I'm just saying, you know.
Oh my goodness. Commissioner Brown, step in anytime. The over 360,000 residents and families who rely on us. I've talked about fostering new integrated partnerships across government and within education, business, health, and innovation, nonprofit sectors to support our shared interests and shared customers. And I have underscored the monumental responsibility we all share of rooting out racism and inequality, which permeates our systems, stifles our mission, and drives up costs for Franklin County taxpayers. It would be a stretch to say that the changes we made over the last several years prepared JFS for the challenges we faced in 2020. Nothing prepares you for a once-in-a-generation pandemic, but they did allow us to move quickly, compartmentalize, and triage. It is easier to adapt, to change, and explore new ideas and solutions when you've already removed the phrase, because that's the way we've always done it, from your vocabulary. And while there is temptation, hunker down, focus on the variables within JFS system that we cannot control. If this pandemic has shown anything, it is how to link all the health human service agencies together. The existing crises in our community, the ones laid bare in the blueprint, like the need for high-paying jobs and affordable housing, or disparities in health outcomes and youth opportunity, didn't disappear because of COVID-19. The Step Up to Quality deadline moved, but it did not go away. Black boys continue to be overrepresented in the criminal justice system. No, what this pandemic has shown is that silo systems perpetuate racism and inequality, and that this dual public health economic crisis will only exacerbate disparities unless we act collectively. When the pandemic reached our state in the spring, our agency acted swiftly and decided to prioritize health and safety of both our employees and the residents and families we serve above all else. We created alternating staffing schedules to drastically reduce the number of employees in our buildings and quickly began leveraging new technology like Microsoft Teams and Office 365 platform to support remote working. By May, we had transitioned approximately 87% of employees to teleworking. Most of the full-time employees who continue to work in the office our staff who cannot perform their duties from home, such as certain IT employees and clerical staff who process mail and documents delivered via drop boxes, while the remaining are those who elect to. Throughout the pandemic and transition to teleworking, we have proactively sought feedback from the staff members so we can equip them to successfully carry out their work, whether remotely or on site, and continue to provide excellent service to our residents and families. When we surveyed staff in June, more than 400 reported they were extremely satisfied with their teleworking experience, and more than 250 significantly felt more productive by teleworking. That last point is all the more important. Because of the countercyclical nature of our agency and the benefits we provide, let's look at the applications for Supplemental Nutrition Assistance Program, better known as SNAP. We received 984 new applications for SNAP the week of March 8th. The following week, SNAP intakes shot up to 2,529, nearly a 160% increase. We peaked over 4,300 new applications the week of April 5th, as the repercussions of the statewide stay-at-home order came into effect. One of the ways we were able to meet this new demand was the state's move to delay redeterminations at the onset of the pandemic, which was the right call for our residents and families, but did create its own set of challenges from an agency operation standpoint. While intakes eventually began slowing down as the order was lifted, they started trending back up toward the end of the third quarter. At our high point in May, we had over 183,000 active SNAP recipients, roughly 1 in 7 residents. We're down to less than 165,000 of that last month, but that's still nearly 20,000 more Franklin County families and residents on food assistance than we were the prior year. Applications for cash assistance through Ohio Works First have followed a similar trajectory. Although we did not reach our peak enrollment until July, with this just under 13,000, there were still 2,000 more residents receiving cash assistance last month than there were in October 2019. The trend with Medicaid looks a bit different. The state made the right call in pausing renewals in the midst of the pandemic, so we have not seen as many new applications or reapplications as a result of the churn. Nonetheless, the Medicaid population has continued to steadily rise, from just under 326,000 in February to nearly 340,000 in April to over 365,000 in August. There is a lag in state reporting for Medicaid enrollment. There were over 50,000 more residents on Medicaid in August 2020 than there were in August 2019. That is more than a quarter of all residents in our county. Those numbers, all of this, should sound jarring. However, we need to be clear-eyed about the reality that we are in a recession. Our Strategic Transformation and Research, or STAR unit, has already begun analyzing trends from 2008 recession to try to forecast what we can expect. They found that the SNAP demand was a lagging indicator in Franklin County and took a much larger return to pre-recession levels. It took 65% longer for the demand in food assistance to return to normal levels than it did for employment to go back to normal. And we saw the peak of employment occur in September of 2009, 16 months into the recession. But due to the fact that lower income families do not have savings, they die from food secure to insecure within 1 to 2 paychecks. It may take years for Franklin County to see our SNAP demand go back to pre-COVID levels, similar to what we experienced in the last recession. During that recession, we saw peak demand for food assistance in Franklin County at an astonishing 56 months into the last recession, 40 months, over 3 years after the peak in employment. For perspective, total SNAP recipients did not return to pre-recession levels until the end of 2018. Again, recipients went from 144,000 in February of 2020 before the recession to 180,000 by April. Although the slight fluctuations have occurred since, the number of SNAP recipients have remained relatively steady. If trends continue the way they did during the previous recession, we will see modest monthly upticks in SNAP recipients, potentially for years as we saw from 2009 through 2013. Following that, We could see slow incremental decreases potentially for years until we move backwards pre-recession levels. All this could very well change as cases spike again and we face more lockdowns, or if we indeed get a vaccine and businesses are able to stay open. It is difficult to predict, but Franklin County should be prepared for what we may be in for a long journey back down to pre-recession levels of SNAP for families. While managing the influx of new applications, our core federal benefits program, we have also used special allocations from the state as well as CARES Act dollars provided by you and the City of Columbus to provide further support for families impacted by the pandemic, as well as early childhood providers that serve them. In March, the state provided $1.5 million in special temporary assistance for needy families, TANF funding, which we used to establish our COVID-19 response PRC program. The idea was simple: provide direct financial assistance in form of one-time cash payments of $500 for families to use to meet the emergent needs and expenses brought by the pandemic. We created eligibility guidelines, the application, even our own online intake form, a first of the agency. We launched the program the morning of Thursday, April 2nd, and the funding was exhausted within 24 hours. Residents submitted 4,733 applications, and our agency approved 3,000 applications, the most we could. We also used an allocation of CARES Act funds from you, commissioners, to establish our PRC Plus rental assistance program, which was implemented June 1st in anticipation of a surge of evictions that would follow the lapse of federal eviction moratorium. The program extended eligibility for PRC rent assistance to families with incomes up to 300% of the federal poverty level, who would not otherwise qualify for a rental assistance under our standard PRC program. You also provided us with additional flexibility to cover up to 2 months of rent, the past due months, and the next one at up to $1,500 a month. We've approved more than 110 applications for over $130,000 in rental assistance and are a part of a network of public and nonprofit agencies serving families on site at the eviction court, currently operating at the Greater Columbus Convention Center. We also received joint applications and CARES Act funding from you and the City of Columbus, Franklin County child care providers that have been financially impacted by pandemic-related closures. Our Columbus Franklin County Child Care Stabilization Recovery Grant provides funds to cover or alleviate costs of reduced teacher-child ratios, smaller class sizes, new sanitation protocols, and other pandemic expenses. Programs must have publicly funded child care agreement with the state of Ohio in order to qualify. Eligible child care providers can request up to $24,000 and home-based child care providers up to $7,500. As of November 16th, we have approved applications for 321 providers to the tune of more than $5.4 million. I want to talk more about childcare because we know 2020 was going to be a milestone year for our early childhood system, even before the pandemic forced closures and revealed for those who did not already recognize just how essential this work is. Step up to quality. This year was the year that the state's Step Up to Quality early learning mandates went into effect. Although, like anything else, COVID-19 had some say in it. As you know, Step Up to Quality is a 5-star quality rating improvement system for child care providers administered by the Ohio Department of Education and the Ohio Department of Job and Family Services, established by the Ohio legislature as a part of the 2013-2014 mid-biennial review. It mandated all child care providers obtain at least 1 rating by July 1st of this year in order to continue participating in publicly funded childcare, our PFCC program. The pandemic pushed the effective date to September 1st, but provided little more the way of reprieve. When we first conducted an analysis of the Franklin County PFC landscape in 2017, we found that only about a quarter of PFCC providers were star rated. That meant as many as 23,000 children and 10,000 working parents were at risk of losing access to child care when the mandate went into effect. It will not surprise you to learn that 68% of those children were children of color in the lowest asset neighborhoods in our county. Neighborhoods like Hilltop, the Far East, Linden, and Milo Garden. Nearly 3/4, 72% of all payments were going to unrated providers. This is one of those community crises that predated the pandemic. Franklin County has been and remains thoroughly committed to the mission of Step Up to Quality. We believe that every child deserves high quality, star rated early learning, and that this is precisely why we've committed more than $4 million, the lion's share from our annual TANF allocations, toward implementing the Step Up to Quality standards since 2015. That includes more than $1.4 million in TANF and grant funding this year to support robust, ongoing community outreach to continue offering free training for providers to become star rated. As you know, our training is approved by the Ohio Child Care Research and Referral Association. It covers all modules of Step Up to Quality: learning, development, administrative and leadership practices, staff qualifications, professional development, and family community partnerships. We made the decision to offer online training options at the onset of 2018, in addition to in-person training and one-on-one assistance. That decision paid dividends when the pandemic took hold, as we were able to seamlessly pivot our training to 100%. Since 2018, we have trained more than 1,055 early learning professionals from nearly 500 childcare programs, including 141 this year. We also continue to collaborate with partners like Action for Children and Future Ready Columbus in the lead up to the deadline. We jointly applied and were approved for the over $1 million in funding through the Ohio Quality Infrastructure Grant earlier in the year. The funding allowed Future Ready to cover startup costs to support the expansion of infant, toddler, and preschool classrooms as a star-rated PFCC providers, as well as offer training in parent engagement and conscientious disciplines. Action for Children stood up an early learning child care resource bank for PFCC providers to assist with things like curriculums and classroom supplies, in addition to expanding provider recruitment, retention, and technical assistance. In February, we partnered with the National Center for Urban Solutions, or NCUS, to launch the Calling All Dads initiative. Researchers revealed that gaps in kindergarten readiness for Black children, less than a quarter of Black boys are considered ready to enter kindergarten in Franklin County. And the one way to help improve that is tapping into too often overlooked constituents, fathers. Through this initiative, NCOS recruited fathers to serve as
Director.
I did not touch anything. I promise to goodness. Thank you, Juan.
Yeah, it probably did it on its own. It
They
probably just
also
muted you on
hosted
its
a
own.
series.
Your computer just mutes itself. So
It
yeah,
does.
yeah,
It does it all the time.
yeah, okay.
They also hosted a series of in-person and virtual forums and workshops, and even organized a drive to provide backpacks and free early learning resources kits inside. We also provide information and resources to other stakeholders, including faith leaders and the National Panhandle Council, so they can use their community platforms to raise awareness around Step Up to Quality, engage early learning providers. This grassroots community outreach, when paired with targeted digital outreach, allowed us to remain plugged in with providers even during the forced closures, effectively communicate changes in new guidance to early childhood programs, including the delay of the deadline. When September 1st did arrive, we had just 3 providers in the entire county that had not been star rated or qualify for any exemptions. I'm going to say that just one more time. When September 1st did arrive, we had just 3 programs in the entire county that did not have a star or qualify. Fewer than a dozen families were impacted, and the agency staff worked with those families to directly find them new star rated programs for their children. While this is a monumental accomplishment, we must shift our focus towards 2025, when centers must be highly rated, a 3-star rating or higher. We will continue to make equity the centerpiece of our strategy, both through this ongoing campaign as well through our broad approach to carrying out our agency's mission in 2021 and beyond. Our Family Stabilization Unit. Nothing better exemplifies our commitment to equity than the new Family Stabilization Unit, a 2-year pilot program we set up in June. The Family Stabilization Unit, or FSU, works across local government agencies to help Black boys and their families successfully navigate the challenges of complex and too often siloed human service systems. This is the first of its kind unit that provides wraparound assistance while taking a tailored approach to meet the unique needs of families, all through a social determinants of health and racial equity lens. We are focusing on Black boys. Why are we focusing on Black boys and boys of color? Because that's who the data tells us to focus on. People of color and African American men and boys, especially, are overrepresented in the justice system and face challenges more broadly in the community due to structural and systemic racism. For example, Black students are 3.5 times more likely to be suspended or expelled than their white peers. And even though Black boys make up just 17% of the county's youth population, they make up more than a quarter of the youth in truancy and diversion programs. Statewide, African Americans make up 12% of the Ohio population, but they make up 47% of the population of men in prisons, 74% of the population of women in prisons, and 53% of the youth in juvenile detention centers. Black residents also have lower life expectancies than their white residents and are more likely to die of heart diseases and stroke, according to the Health Policy Institute of Ohio. We're also more likely to suffer or face serious complications from chronic conditions like diabetes. FSU centers the racial and ethnic groups most adversely affected by the status quo. Instead of focusing solely on preventing boys from future interactions with the justice system, specialists also assess needs of their entire household and use a holistic, multi-generational approach to ensure that the family gets the assistance and resources it needs to thrive. The unit is collaborating with the courts, primarily through the Juvenile Courts Truancy and Intervention and Prevention Program, BOC agencies like Office on Aging and Child Support, as well as levy funding service agencies such as Children's Services, ADAM-H, to create an integrated network of support services. We're also working with Columbus State on the workforce component and hope to establish partnership with the prosecutor's office, just to name a few other stakeholders. To date, FSU has already seen more than 140 families. Over 60% already had cases with us. We helped establish new cases for another quarter of them. Based on our assessment, half of the families we've seen already fits the FSU wraparound services. With that said, I don't want the numbers to obscure the human element of this work. Instead, I would like to introduce two men that have been charged with leading FSU to put the work into perspective. I'd like to introduce Walter Dillard, our new Deputy Director of Strategic Initiatives, and Christopher Honeycutt, a Family Stabilization Unit Specialist.
Thank you, Deputy Administrator. And first and foremost, Walter Dillard, Deputy Director of FSU and Strategic Initiatives. Thank you, Commissioner Boyce, Commissioner Brown, and Commissioner O'Grady for really giving us, me and Chris, the opportunity to get on here and humanize those numbers, those daunting stats. The first day Christopher and I began shadowing at juvenile court was actually the Tuesday after Memorial Day. That was one day after the police killing of George Floyd in Minneapolis. His death broadcast to billions across the globe, along with the police killing of Breonna Taylor and the shooting of James Blake, will go on to spark a nationwide and truly global uprising, one we're still experiencing today. But on this particular day down at the courthouse, the wait was almost unbearable. We sat and watched as a 16-year-old Black boy was on trial for charges that surely would land him in the juvenile justice system and then eventually bind it over into the adult system. His public defender, likely overwhelmed with a caseload of other Black men and Black boys, could do little more than just provide the procedural guidance and agree with the prosecutor's decisions. So essentially, this child, he had to defend himself to a panel of white men and white women. There was no time to examine the circumstances that brought that boy there before them, no time to weigh what a restorative justice model would look like. They had to just move on to the next Black boy, the next Black body. It was emotionally exhausting. The kind of exhaustion you can only know as a Black person in America who's seen these scenarios play out over and over and over throughout your life. But the silver lining in the cloud of doubt was it was galvanizing, and it reinforced just how necessary this unit and this work is. But that has not made the work any easier, as my counterpart, Christopher, can attest to.
Firstly, thank you to the Board of Commissioners, as well as Deputy County Administrator Joy Bivens and Deputy Director Walter Diller for having me. Walter and I, along with the rest of our team, have all worked with Black boys and families, although in different capacities. That experience and perspective is critical for this work, but that doesn't mean any of us were prepared for what it would be like when we first started taking referrals, especially in the midst of a global pandemic. We didn't appreciate just how many grandparents, aunts, and uncles are raising boys. They're trying their hardest, but many of them are working multiple jobs or multiple shifts just to keep a roof over their heads. They don't have the time or the resources to master new apps and technologies that have emerged as schooling has moved online. The young men we're seeing aren't bad kids, they're just kids. And most of the time, they're just trying to kill time and fill the void of missing their peers. Naturally, they're not thinking about the future or the long-term repercussions of their actions. Realistically, what 14 or 15-year-old does. During a recent home visit with a young man who had just become a father at age 16, Walter asked him what his plans were and what he needed to be successful. He responded, "I just want to be alive." He said, "If I wake up tomorrow, that's success." And myself, in early October, I met with a mother who came to court to file an unruly complaint against her 15-year-old son. She didn't want him in trouble with the law. She just worried about him because he had been chronically AWOL since the lockdown in March. He was the type of young man who was a great student, a gifted athlete with loving, successful siblings. And then less than 24 hours later, I received a call from the truancy diversion officer that that young man had been shot and killed in North Linden, 15 years old. So these are the stakes FSU is dealing with. This is the reality that our system has created. Our hope is that FSU will become a scalable model. And we're going to measure success in each family's life we're able to make just a bit easier. And every family we can give a better fighting chance to survive. Thank you all for having me.
Our integrated human services approach. Since the first lockdown, we have heard people clamoring for a return to normal, but normal was not working for Black people and other people of color. It wasn't working for poor people and the most vulnerable. A big reason for that is that our silo health and human services system, which fuel existing racial disparities. In my new role as Deputy County Administrator, my goal is to recenter our systems and processes, starting with JFS, Office on Aging, Child Support Enforcement, and Justice Policy and Programs around families and residents. All of this stems from the Rise Together Blueprint, which itself comes from the hundreds of conversations with families and residents living in poverty. They diagnosed a problem with our existing system and recognized the need to work together. They also changed our county to address the role of systemic institutional racism as an underlying factor of poverty. That includes rooting out implicit bias in our own organization and policies, and some of that work is already underway. Thanks to the historic investment in racial equity that you have made this year. It means treating racism as a public health emergency and using your new core principles of racial equity as another guiding principle for our work. It also means the agencies under me are going to see how we can better integrate our services and use behavioral economics so we can do a better job meeting residents and families where they are. One word you haven't heard me say as much in this testimony is customer. And that is by design. What I have been talking about with aligning and integrating the health and human service system is a fundamental change in the way we interact with families and residents we come into contact with. We're not job and customer services. Our county mantra isn't every customer every day. Our public servants, but we are also neighbors, cousins, and friends. Several years ago, I used my testimony to talk about the idea of moving from transactional to transformational. Your relationship with customers is transactional, but your relationship with families and residents can, and I would argue must be transformational. So, in addition to removing, because that's the way we've always done things, we're also going to be removing customer from the vocabulary of your health and human service system. Our county, our entire nation is in the midst of a reckoning. It's a reckoning around racism. It's a reckoning around the gaps and disparities in our system as a whole that have always existed, but has been spotlighted, trained on them in this pandemic. We cannot go back to normal. We will not go back to normal. We can only work together to create a new normal, and we are eager to get to work doing that in 2021.
Questions? That's the last slide. Questions? I'll start off. Let me dig right into it. So, Director, help me understand. So, what is there's so many documents, and then I'm trying to listen to your
Right.
testimony and go back and forth and just thought process. But what's the difference between last year's budget and this year's budget? I just want to be clear for JFS.
So, Commissioner, I'm gonna tap Christy to jump in just regarding the budget. As you know, last year we did a really good job of doing those inter-county across agency transfers. We were able to transfer dollars that we were underusing and swap with another county's dollars that they were underusing.
Right,
That assisted our budget tremendously. I don't know what the percentage of that is offhand, so I'm going to tip Chrissy to kind of talk about that.
It's because it looks like it's a reduction from last year to this year. And if so, I'm just trying to make sure I understand. You know, my logic for this question is just trying to understand if we're cutting anything, and we need to be conscientious about if more dollars come in, where we can quickly turn to refill positions. And I also want to make sure we're not making cuts that impact some of the really important services that you talked about. So that's just one. And there's different numbers on different sections inside. I just get a little confused. And so Christy, might be helpful if you just kind of.
Christy, will you talk about our TANF allocation and what we're trending at from last year to this year?
Well, yes. But I think Commissioner Boyce, I think your question was more initially over the entire budget.
Mm-hmm.
And so our original budget in 2020 was 92 million.
Mm-hmm.
But our revised budget, which might be what you're looking at, is 106 million.
Right.
Because we had the CARES Act funding, the child care, for the child care stabilization grants. We had it we got additional money from the state for the COVID emergency payments back early at the beginning of the pandemic. We've had the PRC plus dollars. We have all of those. And so that is why the majority of the increase during 2020 that our budget went from 92 million to 106 million. So then if you move forward to what we've requested in the 2021 budget, our recommended budget is essentially 92.5 million, which is just slightly over what our initial request was for 2020 before all the changes happened. So it's not really a decrease from 2020 to 2021.
Great. That's exactly the way I need clarification. I was trying to understand. I knew all of those dollars. I just wasn't. There's nothing that kind of highlights just what the increase, what those different funds increases were. So that was really a helpful explanation. But Chrissy, you probably will answer the second question too, which is for one. Let me just recognize Walter and Christopher. I love these guys. I think they're doing an amazing job, and I just love their passion behind their work. And you guys just keep on doing what you're doing, and thank you because this is real work. What you're doing, real impact on real families, and it's, to use Deputy Administrator Bivens's words, transformational. And so so thank you. But what is the budget for the FSU unit for 2021? And what is that? I don't see a line item necessarily for that, Director, and I want to just understand what their needs and resources are.
Christy, will you break that down from this year to, thank you, because I don't have it in front of me.
So there is a specific budget. We asked for an increase in the 2021 budget specifically for the Family Stabilization Unit. So you might go back to the initial question that we just talked about. I had said it looks like it's kind of flat, and you're saying, how could we have an increase? Back to, I think, one of the questions that you had with Office on Aging about it going down. We had 27 pays in the 2020 budget. So you take that out in 2021. And for JFS, that's significant from a budget perspective. Our payroll probably runs at like 1.6 million. So if you take 1.6 million out for that extra pay, and it actually, our FSU budget is 1.6 million. So those two from an appearance makes it look like our budget is flat, but really our budget would have gone down for the 27th pay, but then we have an increase that we requested for the family stabilization budget. And so in that 1.6 million that we requested, it includes all of the additional positions, which equates to 14 in total going into 2021. And then it also includes dollars for supportive services that are outside, above and beyond PRC dollars. So any services that are needed for our families that are PRC eligible would still be paid out of our PRC allocation, which is TANF funds, but there may be either families that aren't eligible for TANF or services that aren't eligible under TANF rules. So we did budget for supportive services that are non-PRC eligible. And then we have other budgets for training and registrations and supplies and equipment. And then for the software and stuff that they'll be using. And so we have a budget that was included in the 2021 budget.
Great. That was an excellent explanation. It's very helpful. And that's just really all I need to know. Thanks.
Thank you.
Joy, I had a question regarding, you had talked about the eviction help that we were providing with CARES dollars or other grant funds that we were able to get. We're expecting a new round of evictions in January. Are we preparing to be helpful? I mean, hopefully we get another round of federal help, but if we don't, this community is going to be hit hard with evictions and our families are going to be hurting badly. Are we preparing the community in a way to be rallying around to be helpful, the private sector as well as the public sector to be helpful?
So Commissioner, as you know, there were a lot of CARES Act dollars that came into the community and then we went out to our community partners. So this, for instance, Impact received more families than they could, than they had dollars, which in return for us underspent our PRC dollars or PRC funds that we normally would have spent, we would be higher trending by this time of year. However, when we saw that we were not expensing those funds down, we did videos, we shot it out with social media and let the community know that they can apply for PRC. Even if they've applied before, we told them to apply again and not worry about having to call in to see if they qualify. So as you all approved that for us to take care of the delinquent month, but also the month forward, but we're doing, I believe, a really good job of getting the word out in the community for them to apply for these funds because they are there. And I don't know how much money is in our PRC Plus fund right now, Commissioner. I knew that we almost had about $800,000 the last time I checked, the reason why we just recently did that video a couple of weeks ago. Mm-hmm. But then we still have the PRC designation that for our TANF eligible families as well.
Are we able to go to the private sector and get help for the eviction crisis that's going to be impending going forward?
Yes, Commissioner. I think there is the housing, and I cannot think of the name of it, so I apologize. I remember.
Alliance.
Yeah, Housing Alliance.
Mm-hmm.
There's an alliance, I believe, that assists with that and is in contact with the private sector. But my recommendation probably would be to utilize the Innovation Center Board of Directors to start rallying and ask and to make that ask.
I think it's not too soon to do that because we don't know when there's going to be a federal bill that gets passed. And we know that evictions are coming again in large quantities and our families are going to be hurt right around the end of December. And it's going to be very difficult to help them otherwise in a big way. I want to thank you for the work on Step Up to Quality. This is a big thing, and you and your team did an amazing job with Step Up to Quality. To get to where we ended up was just fabulous. And our families getting publicly funded childcare win out even during the pandemic. They will be okay. And we were in jeopardy, in great jeopardy. And this is a big thing. We talked about this being a workforce issue for so many people. And it clearly is a workforce issue for so many people. Now we need to work on the rest of the story, which is the 3 stars, but it's also beyond that. It's getting childcare workers to get decent pay so we can keep childcare workers in the workforce. And I think we have a ways to go there, but we've got to work on that. I think the Family Stabilization Unit is outstanding, and the leadership of Chris and Walter is amazing. Thank you for that. Truly amazing leadership there. And what I've seen and what I've heard, just outstanding. The joining of all of the human service agencies can't be, the timing was right to do it. I wish it would have happened earlier, but I'm thankful that we have this now and that you're at the helm, because we need to have the human service agencies all working together. We cannot work in silos any longer. Time has shown that does not work any longer. So I'm very thankful for that. And I look forward to seeing the data that comes out of this joint human service arena.
Commissioner, just really quick, I will be remiss. I needed to make sure that, and I know I said it in the testimony, when the mandate, the Step Up Quality mandate came forth, it was a crisis when it came out. As you all remember, the governor sent a representative to Franklin County Job and Family Services to tell me 3 times he could not and will not move that deadline. It is monumental, the work that has been done in that. However, had you as commissioners not designated those dollars for this initiative, we would be in trouble. There were no federal dollars and there were no state dollars to support that mandate. But you as commissioners made it a priority to ensure that you were not only approved dollars, but did innovative things and provided training for every child care provider in Franklin County, home and center. So thank you for that.
So to the team at Job and Family Services, this has been a monumental year. Lots of big things happened this year outside the pandemic. And so kudos to you guys for a lot of success this year. Mr. Dillard, Mr. Honeycutt, congratulations on a lot of great work that's been done already. Brand new initiative with the FSU, and you guys have hit the ground running, and you're doing fantastic work. Very proud of you. But to the rest of the team at JFS, you always do amazing work, and you always make the commissioners proud. The community is, as Commissioner Boyce likes to say, this is his favorite agency.
It's not. He doesn't like me.
Yeah, John, I never said that about JFS. I never said that about Director Bibbs. No,
the most important agency.
I said
in
Walter.
All
Walter and Christopher, they're good, but yeah, I never said anything about with her. No.
He always says JFS is the most important agency in county government. Their favorite agency, I love to get Kevin in trouble with all of county government. But no, all kidding aside, we have a lot of great agencies in county government. Everybody does great work, but JFS is because it's so big and because it touches so many lives in Franklin County. It's truly boots on the ground. Not that aging's not that child supports enforcement's not that all of our agencies aren't, but JFS is really where the rubber meets the road with so many families in this community. And we get the occasional, hey, I called and they didn't call me back, or the phone just rings.
Right.
We get those all the time. I had an interesting one yesterday where and the letter was actually sent from ODJFS, not from JFS, but I got one yesterday where they sent me a letter saying that I applied for benefits, and I have never applied for benefits in my whole life. And so I got a hold of Bart, and Bart got on it. Worked it all out, but that was an ODJFS issue. But anyway, it's been a big year for the agency, and once again, to be celebrated. Great work. And I know throughout the course of the year we ask a lot of questions, and we push you guys to do a lot of work. And hey, look, we're nearing the end of 2020, and 2020 has been a rough year. It's been a rough year for so many folks in so many ways. It's been a rough year for so many of our agencies. It's been a rough year for county government. And guess what? It's just the end of 2020. Just because 2020 is over, everybody's been saying all year, can't wait for 2020 to be over. Well, guess what? 2020 is almost over. 2021 is not going to be any better.
Right.
2021 is going to mean tighter budgets. 2021, the pandemic's still here. 2021 is going to be rough as well. And so what I'm saying to the agency is, what I'm saying to JFS is, need you to do it again. Need you to, tighten the belt. Need you to, while we're all suffering from, COVID fatigue, while we're all done with, video conferencing and being on Zoom and being on Microsoft Teams and WebEx, and God, I hate WebEx. And we all hate what we're dealing with. We all have to deal with it more. And we all have to pick ourselves up every day and keep going. And at JFF, we need you to do more. We need you guys to be the rock, because there's so many families out there counting on the work that JFS does every day. There's so many folks out there that are hurting right now that need JFS to be that rock. And so we appreciate everything you guys are doing, all the work that your agency does to support the community, and as I always say, to make the commissioners look good. But we need you to keep on doing it, and we'll be here to back you up as much as we possibly can, as often as we possibly can. But we need you to keep on doing it. So as we end 2020 and we celebrate the end of 2020, just know that going into 2021, we need you to keep going. So thank you for everything you're doing. Let the agency know, those folks that I'm not talking to right now, let all of them know that we love them and we appreciate all they're doing, but we need them to keep going.
Thank you, Commissioner. All right, Zach, hurry up before Commissioner Boyd start asking questions.
If there are no further questions.
Yeah, man.
That would conclude this afternoon's, as well as the testimony for all the 2021 recommended budget. Over the next couple of weeks, the Office of Management and Budget will work with county administration, your offices, to put together the final budget resolution, which will be presented at briefing on December 10th and scheduled for approval at general session on Tuesday, December 15th. And with that, thank you everyone for your time today.
Good work, OMB. Good work, county administration. Thanks, everybody.
Thanks, everybody.
Thanks, everybody.